So, friends, today we are going to talk about spacing between the teeth. Normally, when we consider spaces between the teeth, we have to talk about it as an abnormal situation. But here, I'm talking about space in children, which is considered normal. If you take, if you have consider the primary set of teeth, you can see spaces between all the teeth. But this space is slightly more between the primary canine and the primary lateral incisor. The lateral incisor is the second tooth from the midline in the upper arch. So the gap between the lateral incisor and the canine is more in the upper arch. Whereas the same situation in the lower arch, it is the space between the canine and the molar that is more. These spaces we can see in almost 90% of the kids. And this space is needed so that your permanent tooth, when it erupts, will be compensated for. If you do not have the space in the primary dentition, there's all chances that the person can develop crowding when the permanent dentition erupts. Normally, we have two sets of teeth. You have the primary teeth and you have your permanent set of teeth. The primary teeth has, it's out of our topic, but then it's out of curiosity, I'm going to say about that. The primary teeth has three sets of teeth. You have your incisors, two incisors, one canine, and two molars. Whereas in the permanent dentition, you have two incisors, one canine, two premolars, and three molars. That means one set of teeth called premolars are more in the permanent dentition. Interestingly, I told you about the big gap between the lateral incisor in the upper arch and the big gap between the canine and the molar in the lower arch. These two gaps are known as primate spaces. So as your permanent teeth erupts, the permanent teeth are bigger in size in the front region and it is smaller in size in the posterior region. The primary molars are smaller when compared to the permanent molars. But in the position of the primary molars, you develop premolars in the dental arch. And the premolars are actually smaller in size compared to the primary molars. So that means there's a compensation that's happening. The big sized anterior teeth is compensated by the small sized anterior teeth and the spaces associated with that. Along with that, you have the spaces of the you have the primate spaces as well. And added to that is the smaller size of the premolars compared to the deciduous molars. So that way also the space is compensated. An interesting thing that happens in our practice is that when a child of about 6 to 7 years old, when they come to the clinic, most of the parents say, this fellow used to have small gulling teeth, but then now see doctor, it has become big, broad, it does not fit on his face. But the interesting thing is that this big, broad teeth is supposed to be the teeth on the child when the child has already grown. The tooth after formation will not increase in width or in thickness. It only increases in length. Not even the length, the only the root actually forms. That's all. So the length of the tooth can change according to the age till the root is completely formed. So after that, there's no much change happening. So the big broad teeth tooth that you see on the patient on the child's face at 7 years old is the same tooth that has to be there when when the person is 70 years old as well. So by the time he's 25, his face will already grow and the size of the tooth will become proportional to the size of the face. Similarly, there are some transient phases in the development of dentition where spacing can happen. That is also normal. These situations are normally known as ugly duckling stage. Say when the patient is around 8 to 10 years of age. During this time, the canines are erupting and there will be pressure on the roots of the lateral incisor, which will give a particular curved appearance for the front teeth with spaces in between. Interestingly, my professor had come to my clinic to inaugurate my lab, and when he came, my second daughter was 13 years old. I know she was 8 years old, and she was going through this ugly duckling stage. And my professor fondly tapped on her head and said, "Ah, you have an ugly duckling at home." Poor girl, she got offended. She thought my professor called her an ugly duckling. Then he had to sit and explain to the patient, to my daughter, that he did not mean to say that she is ugly, but then she is passing through a phase that is called as ugly duckling. So these phases do happen, but then these are transient. Once after, when the canines erupt in the right position, the teeth gets aligned and the problem no more exists. This again is a space. I'll show an image of it as well. As we discussed, most of the mammals have two sets of teeth, a primary dentition and a secondary dentition. But whereas many other animals have additional sets of teeth. Interestingly, another thing that normally we hear in the clinic is that some people believe that there's a set of teeth that erupts when the person is around 60 years old, 60 to 70 years old. And normally what they say is that my grandfather had a tooth erupted when he was 70 years old when all the other teeth were removed. Now, the interesting thing is that normally man has only two sets of teeth. But then there can be situations where the tooth can get impacted. And when the tooth is impacted, it will not be seen in the mouth. Later, when all the other teeth are removed, the bone resorbs and the tooth that was inside the bone will get exposed. It is not an eruption, but then it is impacted tooth stays where it is and the rest of the bone resorbs, exposing the tooth, giving us a pseudo feeling that the third set of teeth erupting. So, friends, I have a question for you today. Mammals, as mammals, we have two sets of teeth. But then there are some animals which has more than two sets of teeth. Have you ever heard of that? Do comment. Thank you.